Hi guys, this is my second video documenting my top surgery journey, and I wanted to talk about what is currently going on. So first of all, I wanted to again uh, thank everyone who has been kind enough to contribute to my campaign. I am so deeply moved by all of your generosity. Again, I don't have the words to express um, how grateful I feel for your help. I know that things are hard, and I know my timing is um, not the greatest right now. But I am incredibly appreciative of all of your contributions. Um, I wanted to today talk a little bit about where I'm at and what is going to happen next. Um, Currently, I am 3 months away from this surgery, and this is just crazy that it feels like it's just right around the corner, and I am just terrified. I go through these like crazy ups of excitement and then like these terrifying lows of like, oh my God, like, am I really prepared for this? And I don't mean that mentally, but more like, do I have everything I need? And I don't. Um, I know that I mentioned on my campaign write up and also on a prior video and on the initial video that I do have to have a full payment for the entire surgery cost, I believe 30 days prior to. So if you really think about it, I'm 3 months away from the actual surgery date, but I am only like 2 months away from having this huge amount of money, um, having to pull together this a huge amount of money to have the surgery. So if you know of anyone that you think may have the means to help or that may be interested in it, please do share the campaign with them. Um, and hopefully we can continue to get some donations. So thank you very much. Let's see where I'm at. Where I left off the last video is I went to, I had my experience with my mammogram, and I did tell you all that it was negative. So I am extremely excited about that. And so the next step was for me to get all of my the results sent out to Dr. Garramone in Florida. So I went to the doctor on Thursday this week. Today is December 29th. And I went to the doctor and got my results faxed to the Dr. Garramone's office. And unfortunately, they're off on Fridays, so they need to get back to me next week to let me know that everything is okay. I have a few other things coming up that are scheduled for next week and the following weeks. And then up to the very last month prior to surgery, that I need to go in for even more testing, like blood work and some other, like a regular checkup and so on and so forth. And the results from all of that will need to be sent to the doctor in Florida so that he can have everything that he needs for to prepare for surgery. Other things that I have been doing, I have been working hard and working overtime, picking up gigs wherever I can, trying to help out however I can. Doing work for donations. So the campaign is not the only means of me trying to collect the money for it. And I am very close to booking the place to stay. I know I had mentioned on the very last video that I was going to wait until the results of the mammogram to get flights and to get a place to stay. And I'm currently negotiating with someone who has a place in Davy, that is very, very close to the area where the doctor's office and the surgery center that I will be going into. So I am trying to see if I can get a deal for just for staying there. So it doesn't hurt to ask. So we'll see how that goes. And so hopefully the plan is to be able to have my lodging locked down before the end of the year or by the first week of the new year. So I'm excited about that. That's just everything that needs to come into place is coming into place at this point. Let's see what else. I am creating a list also to put in there for anyone who is interested in, who can't donate but like has maybe additional like things, recovery things that I could use to donate that as well. And then I'll be adding that to the campaign very soon, hopefully. Let's see. Yeah, so in terms of like my mental health and like where I'm at, I know that I'm not sure if I mentioned my relationship with my parents and them knowing about the surgery. I finally had a conversation with my mother about the surgery. I thought she knew about this after the email that I had sent, and but she doesn't. She didn't, but she does now. And all of the concerns that she shared with me were valid and quite parental. So now that conversation is done, I feel a lot better. I have this like stress and weight lifted off my shoulders because that was definitely something that was on my mind, and I was definitely losing sleep and feeling really stressed about. And so now I can really focus on what I need to do to care for myself and other things that I need to complete in order to get to Florida for my surgery. Okay, so this is already like almost 8 minutes long. That's pretty much where I'm at with the current situation and the current status of moving towards my surgery. Tomorrow is going to be, actually on the 1st, it's going to be my very first day of changing my diet. So I had some results come back indicating that my cholesterol was a little bit high. And so I'm working on changing that right now. And I will be changing my diet, which had been pretty relaxed in the past, whatever months. But I, generally eat really well. And I'm just having to kind of kick out a couple of things that are just, additional enjoyments and things that I really like. So those are going to make it off the menu for a while. So yes, so that's where I'm at. The changing of the diet is something that is starting. It already started like 2 days ago. And I am continuing to do that and hopefully get a little bit more and more stricter as I get into the new year. And this was not a resolution; it just happened to fit into this timing in order to get ready for the surgery. So again, if anyone has questions and or comments, I am open to any questions or feedback or whatever. I did want to bring, before I go, I did want to bring up that my one of the things that my mother brought up when we had our conversation was, I guess, her highest concern was mental health and really being prepared for this surgery and the possibility of falling into a depression, a post-op depression. And I explained to her that this is something that I know it's very real and I know it's very possible and it could potentially happen to me, but that I have already created a coping, well, I would say a safety net or a net of people that I can reach out to and things that I can do in place in case that this happens. I think that the most difficult thing for me will be checking in with myself and being aware of like where my emotional state is during the recovery. And I know that the recovery is difficult because you are you are not as mobile and you're restricted from living your life the way that you are used to, and so that causes a lot of that causes you to feel frustrated and short-tempered, and you could get depressed. I don't do very well being indoors and locked up and laying down for long periods of time. So I know the things that I need to do in order to make myself feel better, which is, eating healthier and, being out in the sun, being in rooms that have a lot of light, and laughing a lot if possible. Those are all things that make me very, very happy and they keep my spirits up. But in terms of like experiencing depression post surgery, I have in place, people that I can talk to, in a place that I can go to check in and make sure that I am talking about how I'm feeling after the surgery. So the importance of having a plan and the importance of everyone that knows me and cares for me, that of the importance of them knowing that this isn't something that I'm taking lightly. I know it's a huge, huge, huge surgery, and that I have been doing a lot of work in preparation for it, and that I am aware of that this is not going to be an easy recovery, and that this isn't going to be an easy thing, but that I do have systems in place, and that I am aware of all the possibilities, and that I am not closing the door to anything. I am not saying that I'm going to go through this and that everything is going to go smoothly and that I'm not going to experience anything. I can't go in with that attitude. Yes, I can hope for that, but I can't go in with that attitude because I have to be aware of all of the negatives, because they are a reality. So anyways, I will end it with I am appreciative of everyone's concerns, and I hear you. I'm here. This is something that I have been looking into for a really long time. So it's not something that just came very quick and that I know nothing about. So yes. So thank you very much to all of you who have been donating. Please continue to share the campaign if possible. Those of you who may have questions or may want to know anything about the surgery or the recovery, you may ask me any questions. I'll answer whatever feels comfortable to me. And yes, and I am really excited that the holidays are pretty much done, and that we're now getting ready to just go right into a whole new year. And I'm really looking forward to this whole new year. And I have a really great positive attitude about this. And I look forward to being in recovery, because that is a difficult part. And so pulling through recovery is going to be the most important thing. So thank you all for listening, for watching, and for all of your donations, and for your continued support.